Hello everyone, welcome to sqadia.com, and in this section we will talk about the skull. And when we will talk about the skull, we will talk about mainly the function of the skull and what are the different bones that make up the skull and cranial sutures. So first, functions and bones of the skull. Very important function of the skull is protection and support. Skull protects the brain, very important organ of the body, and it needs lot of protection because little minor injuries to the brain can cause serious consequences. And besides this protection, it also provides support for the attachment of the facial muscles and other structures. There are 8 cranial bones. Cranium is this part of your skull, cranium. It is made up of 8 bones. Then we have 14 facial bones. This is the facial bones. These are all facial bones. Then some functions of the facial bones. And we will talk about the sinus here. So these cranial bones, 8 cranial bones, is in the front we have frontal bone. Here there is one frontal bone. This is all your frontal bone, forehead, frontal bone. Then on the sides we have the parietal bone. There are 2 parietal bone. And then on the side here, this is the temporal bone, temporal. And on the back is the occipital bone. Then here on the side of the eyes, if you see, there is ethmoid bone, and this is the sphenoid bone. So all these together are the cranial bones. So we have frontal in the front, occipital on the back, parietal on the side. We have temporal on this side here, and then we have ethmoid and the sphenoid bone. This occiput or occipital bone is very important landmark during the normal vaginal delivery of the baby. When the doctors feel this occiput, it means the baby is normally delivering and it's almost on the outlet. So this occiput, occipital bone. Next, these are the facial bones, 14 facial bones. This is the nasal bone. Nasal, it gives structure to the nose, so these are the nasal bones. Then we have lacrimal bone here, lacrimal duct, lacrimal bone. This is the part from where we have lacrimal duct, which is important for the secretion of the tears production here, lacrimal duct. And this is in this lacrimal bone. Then we have inferior nasal concha. These are the conchas of the nose, nasal concha. The middle portion is the vomer of the bone, vomer. This is the vomer. Zygomatic bone. These your facial outlines are the zygomas, zygomatic. These are zygomatic bones and zygomatic arch. Then the maxillary bones or maxilla makes your upper jaw, which has the teeth. So this is the maxilla, and below we have this mandible. So these are the bones of the facial bones here. So we went over the cranial bones, and these are the facial bones. So a little bit about the functions of the facial bones. Facial bones give attachment to the facial muscles, and facial muscles perform different functions, which is frowning, chewing, facial expressions. All these are important functions of the facial muscles. And here facial bones also give attachment or provide sockets for the teeth, which perform chewing function. Then we have the provide the space for the nose. We have nostrils, which are important for the breathing. So very, very important function. Orbital sockets provide protection for the eyes. So these are some important function of the facial bones and facial muscles. In these bones, we have some empty spaces which are known as the sinuses. So here we have sinuses. Sinuses are the empty air spaces in the skull. Here we have 4 important sinuses. Frontal sinus, then we have the ethmoid sinus, we have sphenoid sinus. These are some important sinuses, and sinuses are the empty spaces in these bones which are filled with the air. So this is sinuses. In this cranium, we have sinuses also, which are empty spaces filled with the air. A lot of people don't know what's the function of these sinuses, but it is considered as the place where they can balance the air pressure. And it's important in giving resonancing sound to the voice. Facial bones. Now, next slide we will cover about the cranial sutures. Sutures, as you all know, is come from the word sewing or sew. So cranial sutures are used to connect bones of the cranium. When two bones where they come close together, we have sutures there that cause connection between the cranial bones. First, fontanelle. Fontanelle, what's the fontanelle? Fontanelle are these soft, unossified spaces. In the newborn babies, if you feel their head, you feel soft spot. These soft spots are the fontanelle. We have 2 anterior fontanelle and then we have posterior fontanelle. These fontanelles are important. So later on when the baby grows and there is growth of the brain, these fontanelle give space for the growing brain. So posterior fontanelle close early, and then in the first few years of the life, anterior close. Then the important sutures are the lambdoid suture, coronal suture, and the sagittal suture. Lambdoid suture is between the occipital and the parietal lobes of the cranium. Here, this is your lambdoid suture. Between the 2 parietal bones, we have sagittal suture. These are 2 parietal bones, and in between these bones we have sagittal suture. The third suture is the coronal suture, which is between the frontal lobe and the parietal lobe. Between the frontal and the parietal. This is the side view. So we have coronal suture, we have lambdoid suture, and then we have the sagittal suture in between these 2 parietal bones. And the function of these suture is to connect or adhere the 2 bones together. So here we conclude our section 2, which was skull, in which we covered the functions of the skull, different bones of the skull, which was cranial bone and the facial bone, and we also talked about the sutures of the skull. Thank you for watching sqadia.com.